Mainstream medicine doesn't have the correct diagnosis for chronic pain. That's why medical training doesn't teach physicians effective treatments. Instead, the profession is focused on finding a structural reason for every symptom, while it's 99% more likely that your physical symptoms are arising from physiological responses to the environment. This concept has actually been known for many centuries, dating back to Hippocrates, but the technology explosion combined with the business of medicine has railroaded this approach. I wasn't taught anything about chronic pain or comprehensive rehab in medical school, nor at any point during my residencies or fellowships. I was taught that back pain disappears 90% of the time and that patients should just buy time until it resolves. I recall a conversation I had with a veteran orthopedic surgeon during my first year of practice. You do a little of this and a little of that, and eventually the pain goes away, he said. What I didn't realize for many years was that it was the patients who went away when they became tired of not getting better with such random treatments. It's unclear why I wasn't instructed in systematically treating the known variables that affect pain, since they have been documented in thousands of research papers over the last 50 years. The literature shows that stressors like marital problems, difficulty at work, financial issues, and more are better predictors of how well a patient will recover from back surgery than the actual pathology that is being operated on. The medical system is beginning to come around to these concepts, but probably not at a rate that will help you. My main goal in this book is to give you enough information so that you can develop your own resources. It's necessary to be proactive with your healthcare providers. Not only are physicians not trained in the concept of continuity of care, insurance plans will usually not adequately pay for the resources needed to help you resolve your chronic pain. In fact, the medical world is so procedurally oriented that you will usually get moved from treatment to treatment without any continuity at all. Your anxiety and frustration will intensify, which will increase your pain. If you are in this state of mind, you are not in a good place to make a decision about major spine surgery. The DOC program. In this book, I approach the chronic pain experience differently than most people in the healthcare industry, especially in its surgical arm. The difference is this: you must address all the variables that affect your perception of pain, especially those associated with calming down the nervous system in order to heal. Back in Control reveals the way to calm a turbocharged central nervous system. Typically, when patients come to see me, they've been bounced around the medical industry and their care is completely disorganized. They've usually had some combination of medication and physical therapy, but there's been no follow-up by the healthcare system. They're sleep-deprived, anxious, and barely able to function. They're also angry that the medical profession hasn't found a source of their pain and that there's no solution to their severe health problem. As this book progresses, you will see that the essence of the problem is that Western medicine has medicalized a neurological disorder. Through my own experience of escaping chronic pain, learning from my patients and colleagues, and reading the medical literature on pain, a largely self-directed approach has emerged that I call the DOC, D-O-C, Direct Your Own Care program. The DOC program evolved when I was living in Sun Valley, Idaho. I'd gone from performing complex spine surgery at a major medical center to being a primary care spine doctor in a small town. I was well aware of the risk factors for developing chronic pain and could tell within a few minutes who needed a more intense approach. I discovered that by providing a systematic approach to dealing with all aspects of a pain problem, I could almost always help patients become more functional. But more surprising to me was that not only would they become more functional, many would experience a nearly complete recovery. Patients who had been disabled for quite a while would have a remarkable improvement in their pain, off narcotics, and resume an almost normal lifestyle. Frequently, the new lifestyle was more active and satisfying than anything they had experienced before. I had not anticipated that type of response.